Sciatica is roughly a layman's term for shooting leg pain. This is usually caused from irritation of the nerve roots in the lower aspect of the back. So these nerves can be irritated from anything such as arthritis to more commonly a herniated disc. Standard treatment options for sciatica or really any lumbar problem or low back problem typically consists of a multidisciplinary approach. This usually includes physical therapy, usually medications such as anti-inflammatory medications. It can include other variety of different physical modalities such as bracing, such as TENS units, traction. Can include a variety of different medications as well. Typically, if the easier stuff isn't really effective, such as a therapy and medication, a lot of times interventional options such as epidural injections are very helpful for this condition. If for some reason the sciatica results in progressive nerve deficits such as progressive weakness, numbness, tingling, basically things that may signify significant nerve damage, a lot of times we'll get a spine surgeon, such as a neurosurgeon or orthopedic spine surgeon involved earlier because we don't want to wait too long and have something lead to permanent nerve damage. But most of the time, well over 85 to 90% of the time, any kind of sciatic nerve type of condition we can treat conservatively without having to see a surgeon, and usually the outcomes are excellent. I tell my patients nerve pain is a different beast in the sense that it's miserable, only you know what you're feeling, and it's very debilitating. If you are experiencing sciatica or shooting leg pain, I think CONA physicians are in a great position to get you the relief you need in a prompt and efficient, cost-efficient manner.